Well, good morning, everybody. It is the day after Valentine's Day, so it is February 15th, and it is Monday, and I'm supposed to be going to my surgeon today to get the staples removed. As you can see, staples are still in there, and the reason for that is I've got a nice amount of snow on the ground, so where I have gone ahead and rescheduled for Wednesday to get this done. It's been 2 weeks since surgery, exactly. And I will tell you, ups and downs with this recovery is the name of the game lately. But I guess I've got some, good news, and I just want to share with everybody what's going on. My last report, I said that I had stopped taking all narcotics for pain. And this was done. I just didn't like the way that I was feeling taking 250 milligram tramadols every 4 hours for pain. Um, doing my physical therapy and trying to be medicated prior to therapy. So I toughed it out, and um, which I guess in the long run was limiting the amount of physical therapy I was able to get done. So the last 3 or 4 days, I have decided to really, really step it up as far as my therapy. And all the therapy I do is in my kitchen. And again, therapy that I'm doing is I have a stationary bicycle, so I'm not able to do a full revolution yet, but I do back and forth, kind of rolling frontwards and then roll backwards, to as far as I can do. Um, I'm able to walk without the walker. I'm now using a cane if needed. I am sleeping in my own bed for the last 5 nights, which is absolutely wonderful. Um, so I have been progressing a lot. Now, what's been happening is since I've started this for about the last 10 days, um, there's two things that they look at the home health when you get your home health. They want to make sure that you're able to take care of yourself at home and that you have some sort of limited mobility. And the big thing that they have is they want you to be able to, on my good leg here, they want you to be able to see if you can get, 0 degrees and get this leg as absolutely as flat as possible. And over here you can still see I have a little bit of a bend to it. That's called extension. And the other thing they want to see is they want your knee to come up and do this, and this is called flexion. And they'd like to see 90 degrees, with the ultimate goal being about 120 degrees. And I have been stuck over here at about 10 degrees of extension and about 77 degrees of flexion. Up until about 3 days ago when I decided I was going to suck it up and with the help of Tylenol only, started really working on it with the help of my home physical therapist. And so 3 hard physical therapies in a row. I'm able to go now 100 degrees with my leg, and I was able to get my extension down to about 5 degrees, which uh, basically, literally overnight is quite the accomplishment, and something that was really needed because not seeing any sort of oh, not seeing a degree of getting better. It was really depressing. But something happened, and the pain has decreased a little bit. My mobility has gotten better, and everybody that I've talked to, all the videos that I've researched, all said that 2 weeks is kind of going to be at that area where um, you start seeing some sort of an increase in mobility, and 2 weeks for me was absolutely it. So I am absolutely ecstatic with my leg. I just walked out to the mailbox, which was covered in, no, I got about 2.5 inches of snow. At least it's slushy snow, but I was able to walk out to the road. I'm able to go up and down steps here with the help of a cane. I'm able to walk to the kitchen by myself with a cane, and just increasing the amount of resistance and weight that's needed for a full recovery. Your extensions and your flexions, those degrees will decrease and increase. Um, and those can take a few months, but the pain in my knee, I really don't have pain in my knee. It's kind of a unique feeling. The real pain here is right here in the quad. I mean, you can see I've got a nice bruise here, and that's all after physical therapy. This area right here is completely numb, where everything over on this side is not. So obviously your nerves come this way and go that way. I do have occasionally I'll get a little shooting pain or a throb underneath the kneecap. But the therapies and the exercises that have been given, have been absolutely wonderful. So just wanted to fill everybody in that the next time that I pop in here, uh, the staples should be gone. I'm hoping to have 100 degrees of deflection easy, and my extension I hope to be able to get 3 to 4 degrees of extension without any problem. To say it's easy, that's really not the case, because you can feel good during therapy, and the next day you are absolutely as tight can be, which is the way that I am now. I worked hard yesterday, and today's just a little bit. Today's a little rough to get around because of all the swelling right in here. Again, no pain in here, but the pain is right here in your quad, and that's because right in this area the quad is torn, and this is what we're trying to strengthen back up. And once I finish my home health, I'll be going to an outpatient where I actually go to a rehab office and continue my rehab there. So anyway, there I am. This is day 14, so exactly 2 weeks to the day of the surgery, and I'm actually today's last day. So day 12 and day 13 really started seeing an increase in mobility and a decrease in pain. So I'm a happy camper. It's right what I hear, that 2 weeks is the magic time, and that is all. So until next week, or until I have something else to share, I hope everybody out there just keeps on banging away. It will get better. I promise you, it will get better. And as usual, if anybody has any questions, feel free to contact me. We'll talk to everybody later. Bye bye.